Hi everyone, this is Mr. Neil Writer, consultant audiologist and director of Clearwax. Thank you for joining me in another demonstration video of our recently developed WAXscope. And the WAXscope is due to be launched in early autumn of this year, so if you are interested, please do email info@clearwax.co.uk. So we have a patient with a very narrow, hairy ear canal, and you can see they've got this soft wax, and I'm just using our smallest size specular, which is a 3.5mm diameter specular, to dilate and widen the ear canal. And you can see this wax has also got a lot of skin that I'm just peeling away here. And in a moment, I'm just going to introduce some olive oil spray just to loosen and change the consistency of this. And unlike our flagship product, the Clearscope, which is an endoscope, with the WAXscope, we've actually using a speculum to dilate the ear. And the reason for that is with our Clearscope, in terms of optics, there's nothing really that can compete with the optics of an endoscope. But we have found over the years that it is a bit of a tricky skill for some people to acquire. So that was the reason behind developing the WAXscope, so we can just make the procedure a bit more user-friendly. So you're not having to use the endoscope to dilate and straighten the ear. In this case, we're using a speculum. So I'm just visualizing that wax. You can see how I'm changing the focus. I just want to get the optimal focus for this bit of wax, which is closest to me. You can just see how clear the instrument is as well. So there's no blurring of the instrument. It's crystal clear. It's not obstructing the view. And remember, this is our smaller size specula as well. And even with that, you can really see in the ear canal, we can see the full tip of the sucker. So I've cleared the blockage. There's just some soft wax just at the entrance and the lateral canal wall. You can see I've just adjusted the focus. I'm now going to use a Jobson horn just to slowly remove this. There's no need to use suction here for that. In fact, we could have left it, truth be told, but it's just very lateral. So the patient is a hearing aid wearer. I don't want the hearing aid as the patient's inserting it into the ear to get obstructed and blocked by this bit of wax. So it's just a little bit left. I'm going to try and scoop that out. So again, we're just going to adjust the focus, which is really easy to do on the WAXscope. It's just using your finger on the app. You just slide left to right to adjust the focus. There we go. I've managed to remove that. And we're now going to visualize the patient's ear. So as I said, they've got a very narrow bendy ear canals, hence why we're using the smaller speculum. So I've just got the eardrum in view, and we're going to just adjust the focus there, and you can see we've adjusted the focus. The patient has got a few hairs there, but we can still see the handle of malleus. You can see the capillaries. Really clear view there. You can see the attic region. I hope you enjoyed that video, and if you are interested in the WAXscope or indeed our flagship product, the Clearscope, please do email info@clearwax.co.uk. Thank you, bye.